Dr. Natalie Marks, I want to talk to you about Lyme disease, a topic that I don't think people understand is quite to the extent that it is, both in people as well as our dogs.
That's right. Right now, Lyme disease is considered somewhat of an epidemic, as you mentioned, in both humans and in dogs. In people, they're saying conservatively 300,000 new cases a year, mostly in 5 to 9-year-old boys and in our weekend warrior men. But in dogs, 1 in 16 dogs is diagnosed with Lyme disease. And that's pretty astonishing considering where I practice in Chicago, where we kind of think of it as an urban jungle of sorts. A lot of owners may not think there are ticks around here, and we still diagnose Lyme and a lot of the other tick diseases pretty frequently.
Can we do something about it? I mean, prevention for ourselves and also for our dogs.
Absolutely. And I have a little bit easier job as a veterinarian because we have a lot of options for protection. So one is doing daily tick checks on your dog, which we can certainly elaborate on in a little bit. We have Lyme vaccination, and that's something that as an owner, you should talk to your veterinarian and see if your dog is a candidate for that. We definitely can do things about our environment, staying away from those high-risk areas and cleaning up your yard and doing some things and some strategies there. And then there are preventatives out there that we can talk about. And there's a new product out called Bravecto, which has fluorolana in it. And this is a oral flea and tick chew that protects for up to 3 months or 12 weeks. So there's a lot of strategies out there that we can help protect our dogs, but ultimately some of those can kind of carry over to help protect your family.
Such as?
Well, again, doing those daily tick checks. So if you're checking your dog, checking around the ears, in the ears, around the face, the feet, the belly, and under the tail, you should also be doing that with your kids. So, if dogs are out in the yard and kids are out in the yard, as we like to say, they kind of go together like peanut butter and jelly. So what they're doing is kind of intermixed. So you should be checking your kids in some of the same places, around their hairline and their scalp, their underwear line, under their armpits and around their feet, and making sure they're wearing protective clothing. If you've got a yard where your dog and your child like to hang out, making sure that the playground equipment is in the middle of the yard and not in the brush, keeping the grasses short and cut, making sure you're getting a lot of that debris and brush and any fallen leaves and trees and branches out of that. So you're not really creating a habitat for those ticks. And when you're going out in those at-risk areas, making sure, again, daily tick checks.
I think, though, that although great advice, we could probably overall do more to protect our dogs if we're proactive about it, which is the trick, than we really can to protect ourselves.
Oh, 100%. And you mentioned it, proactive medicine is by far the best medicine. We don't want to react, and especially I'm just talking about my patients. I don't want to wait until a dog comes in with end-stage kidney disease from Lyme disease to try and revert and reverse some of that, all the damage that's been done. That's why it's important to have annual exams with your veterinarian and making sure you're talking to them about what do you do with your dog? Do you stay around the neighborhood, or are you going up to Wisconsin and Michigan on the weekends?
And for those folks that are maybe going to be more exposed, a vaccine that you mentioned earlier, a good idea?
I would think so. And again, this has to be an individual discussion between the veterinarian, the owner, and talking about the patient's overall health and risk factors. But that's really where the Lyme vaccine shines, is for those dogs that what we call are being challenged all the time. They're going into those at-risk areas. They're going in the brush, and ticks kind of do a little dance and jump on, so to speak, and brush onto a patient and then start to attach and engorge. And those patients could have anywhere from sometimes 10 to 50 ticks on them in a day. So remember, and I think it's very important, Steve, for anyone listening, those ticks start off the size of a poppy seed, which is tiny. And a lot of our dogs that are doing that kind of at-risk play have very dense, dark coats. So to find a poppy seed in a dark-coated, heavy-coated dog is really, really hard. And when they start to attach and engorge, they only get to the size of an apple seed.
How important is prevention? I mean, how bad can Lyme disease be?
I can't speak to humans, but certainly for our dogs. The problem we run into is a lot of our dogs come in what we call asymptomatic. So the owner really hasn't noticed anything, but I mean, how many of your dogs really can tell you, like we've talked about, do they have a headache? Are they achy, every other day? Have they had a little soft stool? In Lyme disease, the big thing for dogs is joint arthritis. So having that permanent ache, that permanent pain that has to be managed long-term with medication and really will impede the quality of life is a huge problem. And that's why prevention really is the best medicine.